Hello, welcome back to the Capital Health Plan Weight Loss Clinic video series. I'm Dr. Amy Neal, and today we're discussing the obesity medicine pillar labeled medicine. We'll also go over some dinner ideas. Again, this video is intended for educational purposes only and is not to be sold or replicated. Okay. So in this video, we're going to start with a little review of the two previous lectures that we've done. And we're going to talk about certain medications, both medicines that cause weight gain and medications that cause weight loss. We're going to review specific medical conditions and how they affect weight. We're going to discuss surgical options, the three sort of main surgical options that we see in today's society, and the pros and cons for those. We're going to go over some dinner ideas, and we're going to have a little quiz at the end. Okay, so we're going to review our two previous topics, exercise and nutrition, that we covered in the other lectures. Obesity is a metabolic disease, and it is not your fault. I feel like that I cannot highlight that enough. A lot of people feel like they have just eaten too many calories, or the assumption is they don't exercise enough, but that's just not the case. We know now that it is very much a inherited condition. It has a lot to do with genetics. It has a lot to do with what kind of bacteria are living in your intestine, the food quality that was around when you were growing up or even when you were in utero. There's a lot to it that does not have to do with how much you ate or how much you exercise. So don't internalize that. This is not your fault. But we do want to focus on the things that we can change, the things that we know are going to affect your weight in a positive way. So nutrition, exercise, behavior, these things are under your control, and therefore we want to really focus in on those things. The benefits to weight loss are cosmetic, but also for your health. We're mostly focused on health here, of course, but there's a lot of reasons to work on it. We discussed which is the best diet, and it depends on what your goals are, what your other medical issues are. But for the most part, we talked about vegan, Mediterranean, or the modified keto diet of some sort. We discussed hydration. We went over NEAT, which is that non-exercise activity thermogenesis, which is just all the exercise that you do in a day that's not exercise. So standing, little steps throughout the day, getting up to use the restroom, taking the stairs, taking, parking a little further out the parking lot, that kind of thing. And how that really does matter and add up as the days go on. The best exercise for weight loss, I think we remember, is walking, or just that kind of low-key aerobic exercise that's easy to put into your schedule. And we've, over the years, I've learned a lot from my patients, and I think they've probably learned a lot from me, but they also learn a lot from each other. So continuing to learn from other people and different resources is also important. Okay, so let's jump right in. Medications in the United States tend to be overutilized, overdosed. Interactions are not necessarily checked or are minimized. The effect on metabolism is often not as important at the time of prescription as we would like. And, there's always this benefit-cost balance when we're talking about taking a pharmaceutical medicine, especially if it's going to become an everyday medication. But even sometimes like a dose of antibiotics or a pack of some steroids that you're going to take for a week or two, those things can have a very profound effect, especially if we're doing that multiple times throughout the year. Okay, so again, this lecture is just for your education purposes. If you're thinking about stopping a medicine, it's really important to talk to your physician about it, because sometimes those medications are just absolutely imperative and they need to be there. There may be a way that the dose could be decreased, or a different type of medicine would need to be substituted, but it really is important to talk these decisions through with your doctor. But Okay, so on the left of this slide, we have all of the different types of medications that tend to cause weight gain. I give you a big red arrow there indicating that. The more common ones are beta blockers. After you had a heart attack, you really need to be on one of these for at least 6 months. But sometimes if they're just there for blood pressure, or maybe they're there for your migraine control, there's other medicines that we can use that would have the same effect but not have a negative impact on your weight. Steroids, especially oral steroids, have a big impact on people's weight over time. If it's a shot or the inhaled steroids that we use for asthma, we don't see that quite as much. Nerve pain medications like gabapentin and Lyrica do tend to increase weight, not for everybody, so we would have to look at, if you were thinking of starting one, we would just keep a very close eye on your weight, or if you've been on one for a long time, we may want to look back and say, well, retrospectively, has this caused a lot of weight gain for this person? Maybe we could decrease it, maybe we could change it out for something else. All of the pro-insulin medicines that we use, especially usually for diabetes, so obviously insulin, but also glipizide, glyburide, these medicines, because they promote insulin, make you hungry and increase your storage of adipose tissue or fats. Antibiotics actually play a role with weight as well. The more antibiotics people take over their lifetime, the more weight they tend to weigh. All right, so the ones on the right side here are all of the medications that probably cause weight loss for most people. If something is FDA labeled for weight loss, that means it leads to about 10% of your weight loss within 6 months of starting to take it. Some of these medicines are labeled such that we use them at not FDA labeling. For example, metformin only causes about 5% weight loss over that same time frame. So we don't tend to use it specifically for weight loss, but if you have diabetes or you have, polycystic ovary syndrome or other syndromes, that might be something that we'd want to put on there just because it may lead to a little bit of weight loss, and it's certainly not going to cause weight gain. And it'll control some of the other things that we see with those conditions. Some of the newer non-insulin diabetes medicines also cause weight loss. They're very expensive. They can be very costly and cost prohibitive. A lot of my patients just can't afford them after a certain amount of time. So I try and be real cautious when I'm starting those and let people know, look, this is, we would want to continue you on this, and they can be kind of pricey. So it's important to know what kind of cost you're getting into if you're going to start one of those medicines. Those are like Ozempic or Victoza. All right, stimulants. So both medicines that we use for ADHD or ADD, attention deficit disorders, and also the more common ones are like phentermine, dimetrazine. Those medicines also tend to cause weight loss. Some of the over-the-counter stimulants, like green tea extract and whatnot, can actually have a negative impact on your heart rate or other conditions. So I wouldn't take anything over the counter, but you might consider a stimulant if your doctor's suggesting it, for example. Mood medications, again, they're on both sides of this list, right? So some cause weight gain, some cause weight loss. Just, if you need to be on one of these medicines, talk to your doctor about your concerns, that this might cause weight gain. And they can almost certainly look up which of this type of medicine would be the least likely to have an impact on your weight. And then they would start with that one, very simply. Certain, like Wellbutrin tends to cause maybe a little weight loss. Seizure medicines, again, there are some seizure medicines that actually cause weight gain, but the more common ones like Topamax, which we also use for migraines, can cause taste aversion and decreased hunger as well as cravings. So sometimes we'll use those type medicines. Naltrexone is more commonly an addiction medicine that we use for like alcohol cravings in the afternoon. But these medicines can also be useful for people who have real strong cravings for foods in the afternoon, evening, binge eating disorder. Sometimes we'll, use these, again, not necessarily on label, but they can be helpful, and they're things that are worth discussing with your physician. Okay, so type 2 diabetes We have recently had a big expansion of new medications that are entering the market for type 2 diabetes that actually are pretty good for weight loss. You can see here on the left. But as I mentioned earlier, they tend to be somewhat cost prohibitive. You know, the one that causes at least a little bit of weight loss is the metformin that I mentioned earlier, and it does help at least a little bit, and it's free at Publix, so it's very easy to afford as long as the side effects aren't too bad. And it also works nicely with some of these other medications so that maybe you don't need as high a dose, or maybe you don't need it at all if we combine that with a good ketogenic diet. The other medications on the list, as you can see, insulin here at the bottom causes a lot of weight gain. So just minimizing it if you're already on it. Again, utilizing the keto diet or really reducing the carbohydrates that you're eating will feed into you not needing as much of the insulin in the future and should really help with coming back off of it and maybe using some of the medications that are more weight neutral or help with weight in order to get your numbers under control and make sure you're not getting heart disease, blindness, all the bad things that happen with diabetes. Okay, so I did want to include at least one slide on the two different models, sort of the two different thoughts as to what, we as modern doctors think of as causing weight gain, right? So the whole, again, this is a little complicated, but the one on the right shows the energy imbalance equation, which is basically energy in minus energy out equals energy stored. That's that pure, eating too much, exercising too little, you get big. That's the equation that I think we were all taught and what a lot of people have internalized over the years. That's probably somewhat true, but the other part that really plays a big role is the hormone or the carbohydrate insulin model that shows how carbohydrates stimulate insulin, which then pushes these calories into storage. As we eat more carbohydrates, this effect snowballs and causes starvation inside of the cells and makes you hungry. It sends out all these hormones that make you increase your appetite, as well as inflammation and other harmful things that are happening in your body. So it's another important part of the whole picture as to why this is happening. And a lot of our newer drugs that are coming out all affect the hormone part of this. That's where almost all of our weight loss drugs affect, is more the hormone or carbohydrate insulin model. Okay, so to illustrate how medicines might be helpful for a given patient, I've come up with a couple different examples that we'll walk through real quick, just to give you some idea as to what exactly are we talking about here. These are not real examples, but I promise you I've had plenty of people and real life examples that are pretty close to this. All right, so Bert is 50. His dad recently died at age 68 of heart failure, so he's worried about that. His BMI is 45. His blood pressure is too high. He has type 2 diabetes. He's had that for about 4 years now. His exercise is doing yard work, and he has a history of doing yo-yo diets, right? So he'll go on something, then he'll be off, and then he'll on and off, and his last A1C was 8, so that's a little poorly controlled. We did an insulin level and lipids. Those are both too high, abnormal. His medication list right now is metformin, glipizide, Actos. Those three are all for diabetes. And then he's on metoprolol, that's a beta blocker, lisinopril, that's another blood pressure medicine, and Claritin. I don't know that I put it on my slide, but certain antihistamines also affect weight. So for him, I would probably try and make sure that we've maximized his metformin, make sure he's on a good high dose of that, as long as he's not having, diarrhea or stomach upset. We would try and dial back or get rid of the glipizide, The lactose is fairly weight neutral, so I may leave that alone for a while. I'm going to ask him to, do still some dietary modifications, work on getting rid of those carbohydrates. We may talk about his nutrition or his exercise a little bit as well, maybe trying to step that up. I'm probably also going to work on getting rid of his metoprolol and or just decreasing that because his blood pressure is too high right now. So I need to still do something about that. I may change it to a calcium channel blocker or something else. I may see if I can really increase his lisinopril. But again, my goals are to focus on the first getting rid of the medicines that might be causing weight gain if I can, and then maybe add in other medicines that help with weight loss over time. And the Claritin, if he's not having terrible allergy symptoms, he may be able to switch over to Flonase. And just those little changes all by themselves may cause 10 pounds of weight loss between now and when I see him again in 3 months or so. Okay, so here's my second example. Tara, she's 44. She won a bronze medal at the Olympics when she was 22. A lot of time has happened between now and then. She gained weight after 2 pregnancies and taking a teaching job, so she's stressed and doesn't have a whole lot of time to eat throughout the day. She's starting to notice some knee and back pain. Her periods are irregular. Her BMI is 40. Her knee x-ray shows some early arthritis. She exercises 60 minutes a day, and her diet consists mostly of fast food and or kid-friendly food, right? Because she's got those kids, and she's just trying to like gobble something down between times. Her A1C is in a pre-diabetes category. Her creatinine is a little bit high, probably because of all the exercise. Her thyroid is slightly elevated, and we did some hormone levels that suggest that she may be having a little bit of what we call polycystic ovary syndrome, which is when the female hormones tend to get imbalanced as a result of too much insulin. Her medication list, she's on Benadryl at bedtime. Again, those antihistamines, we might consider doing something about that, maybe melatonin or something else to help her with sleep. Prozac, so of all of our antidepressants, that one's fairly good. We could titrate that a little bit depending on her symptoms and how long she's been on it. She's on that for probably mood and depression. She could be on it for hot flashes or any number of other things. So we have to talk about, why is that there? What can we do about that? Now, gabapentin, she has arthritis on her x-ray, but she's on a nerve pain medicine. Sometimes for my patients, somebody else put them on that medicine just hoping it would help, but for her, she has a weight issue she's been working on. She has arthritis, which is probably being worsened by her weight. We need to get that gabapentin out of there if we can. And of course, she recently got a bunch of steroid shots in her knees, and when she gets them in both knees. So if she doesn't really need them, maybe we can get her to where she's doing less of those per year because those are also increasing her weight. So again, that's kind of how I work through that. Her exercise is good, 60 minutes a day, but she probably also needs to work on her nutrition quite a bit, just spending a little time preparing food, both for herself and also for her kids, because her kids, if she's in this category, her kids probably will be one day too, so it would be good for them to start eating more vegetables in their diet and not eating as much processed food. So, okay, I don't want to spend a whole lot of time on this next slide, but these are some eating disorders and other medical conditions that specifically, if you think you have these issues, you need to let your doctor know and begin kind of working that out and unwinding it. Binge eating disorder, that's when we eat a very large portion of our calories all at one meal. You get in a rush, you feel like you can't stop eating, you feel ashamed about it afterwards. There's usually a deep feeling of shame and disappointment. A lot of times there's hiding of food involved in this, but it can easily be treated. It needs some cognitive behavioral therapy, some talk therapy. Sometimes medicines can also be very helpful for treating this. Anorexia nervosa we think of as being a condition purely of the younger people and they're super skinny. But a lot of times my patients have survived that, and now they're in adulthood and they're struggling with their weight in a way that's still impacting their health, but because they have this history of anorexia, it affects what I would recommend as treatment for them. Bulimia, that's when you're eating and then throwing it up. We do still see this commonly in people who struggle with weight. Sometimes it's a mixed picture of all the above. Food addiction has recently been added to the DSM criteria. And it's basically an addiction just like alcohol or tobacco, where you just obsessively eat certain kinds of food, Think about Mountain Dew, think about Dr. Pepper, think about Doritos, are those things that you're spending that level of intensity thinking about and consuming and obtaining and making sure you have it if you travel or things like that. Body dysmorphia is when you look in the mirror and you see something completely different than the rest of society sees. It's very common. It's important to address that because otherwise you'll just never be happy with what you see in the mirror if that's what you have, if that's a condition for you. Depression is very common. We often get into, do we treat depression first or obesity first? Because a lot of times that's a lot of why people are depressed. But the truth is it doesn't matter. But if you have depression, we would pick a medicine first that would be less likely to cause weight gain. Anxiety disorder, food is a very common drug that we use to calm our anxieties. So think about that. And, again, just treating it, being aware of it is a big part of anxiety disorder. Bipolar disorder, partially because the medicines we use tend to, not all of them, but they tend to cause weight gain. Insomnia is a very big deal. If you're not sleeping, you're going to have a weight problem. Abuse and neglect also is very prevalent among people who struggle with weight. Some medical conditions cause weight gain or are caused by weight gain and have special recommendations. We saw above how certain diabetes medications can cause weight gain or loss, but thyroid disease can also lead to weight gain that is harder to get rid of over time. It's important to make sure that our levels are good, but just recognizing that type of weight gain is harder to get rid of, I think is important, just recognizing that. Heart disease, like congestive heart failure, has special medications that are especially useful to help with weight loss. And treating sleep apnea, if that's present and you have heart failure, is extremely important, as it can make both congestive heart failure worse and also make it harder to lose weight as well. Asthma needs to be controlled in order for patients to be able to exercise and also to avoid having to take systemic steroids on a regular basis that cause weight gain. Polycystic ovary syndrome is a hormone imbalance that starts with insulin resistance and ends up causing unwanted hair growth, irregular cycles, and infertility. It increases risk for endometrial cancer and is very important to address if a patient has this in order to reduce the risk of cancer. Okay, we're going to talk now about different surgical options. These are the three usual or main bariatric surgical approaches used presently. Gastric band is falling out of favor because it doesn't work as well for permanent weight loss as the other options. It can slip, it can cause erosions, and has a high complication rate. We see these being removed on a fairly regular basis these days. Sleeve gastrectomy is the main procedure used today. It removes a portion of the stomach that makes an important hunger hormone and one that affects insulin levels. Thus, it'll affect fat storage as well. These patients have the highest post-op satisfaction ratings. Rogue and Y patients lose weight at a much higher rate, and they're the ones that are most likely to be able to come off of their insulin eventually, but they often have negative impacts on their quality of life. they have vitamin deficiencies, excessive weight loss, etc. Okay, changing gears a little bit, we have just some examples of some healthy dinner ideas. You could do a pan-seared salmon and some vegetables. Chicken and broccoli is a good classic go-to for our family. Turkey chili is another delicious way to enjoy the fall and winter weather. Chicken enchiladas can be made in a relatively healthy way. Again, you want to reduce how much cheese you're putting on there, and you want to really pack the enchiladas with chicken and vegetables so that you're not mostly eating corn tortillas or whatever kind of tortillas you use. Grouper taco salad is also wonderful. It's a good Florida treat, or any kind of fish salad is also really good, or fish tacos. This is my list of references for this slideshow, and I also used some of the references from my previous videos. Okay, we'll do our quiz now. Can you name 2 types of medications that often cause weight gain? So these would be like oral steroids, glipizide, any of those pro-insulin type medications that we use for diabetes, beta blockers, certain kinds of antidepressant or mood medicines as well, and the nerve pain medicines. All right, name 2 types of medication that cause weight loss. So these would be some of our newer anti-diabetic agents, metformin, different kinds of stimulants, Topamax or certain kinds of anti-seizure medicines, Wellbutrin or certain types of mood medications. That one specifically we've mentioned, Wellbutrin, naltrexone as well, which is again more of an addiction medicine drug, but we use it at very low levels to help with food as well. What is the surgical option that has the best patient satisfaction ratings? That was the gastric sleeve. Which surgical option most often needs revision? Pretty sure I said this. This was the gastric band procedure. Name 2 types of eating disorders. So these would be the binge eating disorder, anorexia, bulimia. There's so many, but you can review that slide if you're wondering what the rest are. All right, thank you for watching another one of the Capital Health Plan Weight Loss Clinic videos. I hope you'll return and enjoy our final lecture on behavioral aspects of weight loss. See you next time.